Tonight, we continue our focus on Breast Cancer Awareness Month. And for women who get breast cancer and then choose to have surgery, most of them, 3 out of 4, choose a mastectomy. Well, tonight, a new surgery that confronts the permanent numbness that some women get after a mastectomy. The new surgery is the good news. The bad news? Not every insurance company covers this. So why not? Here's Kristin Thorne.
During the course of a mastectomy, sometimes nerves are severed. There's a procedure that's been around for quite some time called nerve grafting. It's when nerve tissue is used to fill a gap between damaged nerves. But this procedure has not been applied to breast reconstruction until recently. And because there are so few studies on the effectiveness of this procedure in breast reconstruction, there are few insurance companies that will cover it. Sarah Morelli has lots of reasons to live, a wife and 2 small children. But breast cancer threatens that. Morelli's 2 aunts were diagnosed with breast cancer at a young age, and her mother died of breast cancer at 39.
I grew up without my mom, and I have 2 young boys that I don't want to have to go through that.
Morelli decided to have a preventative double mastectomy, but she wanted to have nerve grafting done at the same time of the surgery in order to preserve feeling in her chest.
I would love to be able to hug my children and feel them against me and have sensation in my skin there, even just for safety measures so I don't get burned when I lean up against something.
But Morelli's insurance, Cigna, won't cover it. The company told us it doesn't cover nerve grafting for any condition because there isn't sufficient clinical evidence to confirm the safety and effectiveness of nerve grafting.
It's absolutely ridiculous to me that my health care is being determined not by my provider who's medically trained, but by my insurance company. And I don't want that for other women.
Cigna isn't the only carrier that does not provide nerve grafting following mastectomy. Anthem Blue Cross lists the policy as not medically necessary and that more studies are needed. Aetna does not list the procedure as medically necessary, but includes positive studies in its policy saying more research is needed.
We're still early in the curve. That is part of the issue.
Breast reconstruction surgeon Dr. Tommaso Odona with New York Plastic Surgical Group says not enough studies have been done on the effectiveness of nerve grafting after a mastectomy. It's an issue practitioners and researchers, he says, are now trying to address. Odona says his practice sees some patients get the procedure covered and others with different insurance don't.
We're working on options or opportunities, techniques that better evaluate sensation and responsiveness of a patient after surgery so that we can kind of narrow those numbers and have a better understanding of what our baseline is so we can show the improvement.
Cigna told us it is committed to ensuring that its patients have access to the full range of breast reconstruction and mastectomy procedures and that it regularly reviews its policies as new evidence is published. Patients can also always appeal their insurance company's determination.